Welcome to the Commercial Real Estate Show, your source for insightful analysis and enlightening discussions. I'm Michael Bull, your host to the world of commercial real estate. Thanks for being with us today. Well, our topic today is the healthcare industry and healthcare real estate, and it is a huge subject. Healthcare spending in the U.S. in 2012, back then, was 17.9% of GDP. And you look at the Affordable Care Act, which began enrollment in October 2013, you have more patients. You also have the baby boomers coming of age. And healthcare is an interesting segment of the commercial real estate. It's a lot more involved than most segments, and very interesting discussion to talk about. Well, please welcome my first guest, John Sweet. John is Executive Vice President and Chief Investment Officer with Physicians Realty Trust. They own or have equitable title to $722 million of property, medical office buildings in the U.S., including 40 buildings that they've bought in the last 14 months. John, thanks for joining us today.
My pleasure, Michael.
Well, we appreciate you being on the show and calling in. And let's talk about the impact from Obamacare on the healthcare industry at this point. I mean, you guys study the industry. You see the success of your medical tenants around the country firsthand, and you have the opportunity to talk to healthcare providers on a daily basis about their business. How has the Affordable Act, or Obamacare, as Obama doesn't mind calling it, impacted the business of healthcare providers that you talk to?
Well, it's interesting, Michael, that I have my own views based on anecdotal information and our experiences over the last several months in acquiring medical office buildings, ambulatory surgery centers, and specialty hospitals. And the vast majority of the properties that we acquired were owned by physicians who entered into sale leasebacks with us, where we acquired their property and turned around and leased it to them. Right after our initial public offering in July of 2013, we aggressively went out to invest in medical real estate. And one of the things that we found in those early days was that there was a tremendous level of anxiety amongst the physicians in all practices. Primarily by the uncertainty of what the Affordable Care Act really was going to mean. And that, in part, I think, prompted, over the past 14 months or so, a number of physician practices to sell out to hospitals, to become employed by the hospitals rather than remaining independent, mergers of large physician practice groups into even larger groups, and also a willingness that had not occurred prior to that to consider selling their real estate, particularly the senior doctors in a practice who are interested in taking some capital off the table and entering into long-term contracts with us or leases. And so my feeling was that it was all about uncertainty, and that was the main thrust of it. Interestingly enough, in the past few days, I got the information from a survey that was done by a online physician practice website, in which they talked about everything to do with the Affordable Care Act, and some of the answers were a little bit inconsistent with my own thoughts. But in looking at them, I think it probably has more to do with time than anything else. For instance, they polled about 1,200 or 1,300 physicians, and the question was, how do they feel about the Affordable Care Act? 19% said it was great for America, 42% it was mostly good but was not perfect, and 39% it was bad for America. So you see it was a 60-40 split, and this is in more recent times. And the unique thing, though, that came with that was the question was, how has Obamacare affected your practice? Almost 38% said minimally, 16% said moderately, and only 6.2% said significantly, and 40% said not at all. So I think that the anxiety is still there. However, I don't know that they feel that there's enough has happened yet to see how it's going to end up in the long run. So I'd say the jury is out a little bit on it, but right now it doesn't appear that it has had a big significant impact on practices and physicians.
And what types of specialties has it impacted the most? Are there any winners and losers in the specialties that these physicians are involved in?
Well, two answers to that. One is, I think that any practice that is inefficient has not embraced medical records, does not have a professional manager, is not going to fare well. If I were to then winnow it down into various practices, I would say that the general practitioner and internist is probably going to be a winner in this, because what we are talking about ultimately with the Affordable Care Act is that a certain level of dollars are going to be available for each of us to use for our health care, and that we as patients as well as doctors in coaching us and counseling us will help us decide where those dollars get spent. So essentially, the general practitioner is going to hold the purse strings, and they're the ones who are going to designate which specialty and which specialists will be brought in on a particular case. So I would say that the family doctor, who historically has been the lowest compensated within the realm of the hierarchy of physicians and specialties, is probably going to do well. I would say that on the other end of the spectrum, cardiology, oncology are absolutes, and so I think that they will be little affected by what's happening with the Affordable Care Act. And if there are any losers, it may be in the area of reimbursement in imaging and in dialysis and some other things where the reimbursement rates are being squeezed by Medicare, Medicaid currently, and by private pay. So that'll continue.
Okay, and we're talking with John Sweet with the Physicians Realty Trust, and John, there was a lot of talk about increased demand for office space, for medical office space in particular, with more people being insured and the baby boomers coming of age. What are you actually seeing on the ground there? Are you seeing a lot more demand for space?
No, I'm seeing a lot more demand for efficient space. You know, one of the things that adding 30 million people, or whatever the number is that they're talking about adding to the rolls of the insured, that did not increase the number of doctors. There's a tremendous shortage of doctors in this country. Some estimates are as high as 100,000. And unfortunately, the medical schools are not turning out enough doctors even to cover those who over the next few years will be retiring. The average age of a doctor in this country is 55. And the number of physicians coming out is not going to be sufficient 10 years from now to compensate for those who will begin in going into their retirement years. So that in and of itself will limit the amount of space, doctor space per se. What we are seeing, though, is because the Affordable Care Act is supposed to extend out what had already started, which is moving patients out of a hospital into an outpatient setting, is it's going to now demand a higher level of quality of care as well as a reduction in the cost of providing that care. So what you're going to see is older buildings, inefficient, are going to be vacated, and new buildings that are highly efficient, multi-specialty, with everything in a one-stop shop is going to become more and more important. And to do that, new facilities are being built, but they're more replacement than they are additional.
So you're expecting demand to increase for these new buildings? Do you expect construction to ramp up?
We do think that there's going to be some expansion of outpatient facility development, and as the hospitals continue to acquire the physician practices, while they may wish to leave them in their current location, some are going to feel that they need to put those doctors in a new outpatient setting, maybe in a different in a different geographic area, in order to capture a higher percentage of future patients coming in an area that may have a higher level of private pay as opposed to where they are now. So we do think that that's going to happen. Now, the other side of it is human behavior. Massachusetts as well as Hawaii have had a socialized medicine plan for some time now. But what they both states found is that the volume of patients showing up at the emergency rooms has not diminished. And that's because of the behavior of those who historically have been uninsured, will not go to a doctor till it's absolutely necessary. And by the time that occurs, it means going to the emergency room. So people's habits and traits have to be changed before you're going to start seeing the waiting rooms of general practitioners filling up.
Okay. And John, are you guys still in a buy mode there at Physicians Realty Trust?
Absolutely. We're growing at a fairly rapid pace. We'd like to think that we've made the whole process a little easier. All of us come out of the healthcare world as opposed to out of real estate per se, and because of that, we think we have a pretty good understanding of what physicians are faced and what hospitals are facing, and we think that we make a pretty good partner for both of those groups, and hope to continue to grow our company.
John Sweet, thanks for joining us today. We appreciate it.
My pleasure.
Well, stay tuned. We're having more on healthcare and healthcare real estate. I'm Michael Bull. This is the Commercial Real Estate Show. We'll be right back. The Commercial Real Estate Show is brought to you by Florida International University and Bull Realty Commercial Brokerage, a great place to do business. For more information on these companies or to access additional podcasts, videos, or blogs, visit commercialrealestateshow.com.